Hi, I'm Dr. Tangchitnob. I'm a board-certified OBGYN. I practice in West Covina, California, and I have a specialty in robotic and laparoscopic surgery.
Hello, my name is Dr. Tangchitnob. As a board-certified OBGYN, I have practiced obstetric gynecologist in West Covina for the last 25 years.
I think what makes our practice unique is the father-son element of what we do. You know, as you come to the practice, you get a sense immediately that there's years of experience behind the practice. But at the same time, as you come in, you walk around, you see that this isn't your ordinary practice. The practice itself is brand new, it's state-of-the-art, but it's definitely infused with years of history. I think I had a lot of options growing up. Certainly seeing you leaving every night in the middle of the night to go deliver babies was not always easy to do, but you know, at times at the dinner table, I remember you tell me about all the stories about all the babies you delivered, and I think that piqued my interest.
Having been a solo practice so many years, I'm very pleased to have my son join my practice. We're able to do surgery together. The surgery time is less, the safety of the patient is much more, and the outcome is just superb and excellent.
So robotic surgery has really allowed me to marry and bring together the two passions of my life, which include engineering and medicine. It's a novelty almost that one would be able to enter the abdomen with just small incisions. For example, should a woman choose to come have surgery with us, one of the perfect examples would be the option of laparoscopic surgery. Laparoscopic surgery is the type of surgery in which small holes are placed in the abdomen that allow us to go inside and perform the necessary functions of surgery. Do you remember when we did the first robotic surgery together?
Yes, it's such a good time. Imagine those days that I have to operate patient, open the patient, post-op care. Patient have to go through all the pain, fever, stay in the hospital 3 days in the hospital. Now, guess what? We have surgery that patient able to go home next day, even the same day.
2 to 3 days, I can't even imagine that. Most of our patients go home the same day or even the next day now. I know when we're rounding, most of the time the patients or the family asks, when can my relative go home? And we say usually maybe after breakfast. You may have heard of robotic surgery. This is something that's on the news and even all over the internet. Now with robotic surgery, the technical word for it is actually robotic-assisted laparoscopic surgery because it's the robot and the laparoscopy portion of it that controls and allows us to gain entry into the body. Many of us often get asked, between my father and I, for example, does the robot do surgery? In fact, no. No matter how advanced we get, the robot still does not do the surgery. We are at the console.
I'm so happy I can tell you now, it make my life complete. I'm so fortunate to have you back, and I'm very happy that you choose OBGYN.